a lot of physician will compensate you and give you educational credits to help you. Hi guys, welcome back to my channel. My name is Lori. If you are new here, I am a family nurse practitioner and I talk a lot about nursing on my channel. I share a lot of my stories, a lot of my journey, and also I give advice, encouragement. Today's video is for my nurse practitioner students. I want to talk about the nurse practitioner contract and what are some of the things you should try to negotiate and try to advocate for yourself to be in that contract, especially when you're getting that first NP job. I know I have been doing a lot of NP type videos, but for my nurses, also for my CNAs, I have some videos coming. Just give me a little bit of time. On my last video, my last vlog, I shared with you guys that I had some nursing books that I could give to any nursing student who is studying, and a lot of you reached out to me. The people who reached out to me, it was pretty much first come first service basis. I did find some more and I would pretty much go back down the list to see who reached out to me first, and that's how I will give the books away. So having said all that, make sure you are subscribed to my channel and also click the notification bell, and let's get into this video. For the purpose of this video, I will only be speaking about getting a job with a primary care doc, a physician that has his own practice and you're going to be working with that physician. I'm not talking about getting jobs in like the hospital setting or a large corporation because I don't know anything about that. I try to only speak on things that I have experience with and things that I know about, so I don't give wrong and misinformation. So let's put that out there. But when I first got hired, I didn't really negotiate a lot of the things, and the reason why is going to be my first tip for you guys. Whenever you are trying to find a job, even not even for NPs, you need to try to do some research before you get that interview. And I say this because do not go into the interview and don't have kind of like some base knowledge. Example, how much money are they paying new NPs in the area in which you live? Little things like that, because you might get into a situation that I was in. When I found my first job, I went to the interview, and basically halfway through the interview, I was pretty much being hired, and we were talking contracts in that interview. So he was asking me questions like, so how much money do you expect to be making? How many patients can you see? So I had an answer because I had a couple of friends already who already found jobs, and I actually told him $10,000 over what the average was, and then he said, well, I am paying this amount, and the amount that he was paying was the average. So I didn't felt like he was cheating me out of anything. So that's why I'm definitely, that is my first tip for you. Now let's talk about the things that you really should advocate for to be in your NP contract. You need to have in writing and in that contract how many patients they want you to see per day. And this is going to come in very handy when you are working and they try to force you type deal to see more patients, or telling you that you're not carrying your weight. No sir, because this is how much patients it was contracted, obligated to be seen. So say for instance, the physician tells you he wants you to see 15 patients a day. Now 15 patients a day, if you work Monday through Friday, is going to average equal to like 300 patients for the month. I will encourage you to have a conversation with the physician to say, hey, if I see 300 patients a month, you're cool, right? Because there's some days that you might see 10 patients and the next day you might see 20, and it would average out. But sometimes you do have some physicians who are a little nitpicky, and they will try to say, well, you're not seeing the amount of patient that you're supposed to be seeing, and it's only like halfway through the month. So you know, just a quick, if I see 300 a month, you're cool, right? We're cool. We know that I'm supposed to see 300 per month. Also, let's talk about if you see over the amount that you're supposed to be seeing. I told you guys this in my NP salary video. I will link it somewhere, I don't know, one of these, and also in the description box if you have not seen that video about the NP salary. But in that video, I touched a little bit on a clause that you can put in your contract that is pretty much saying, if I see over the 300 patients that I'm supposed to see for that month, am I going to be compensated extra? And 9 out of 10 physicians do this. I'm just letting you know. Some of them probably don't bring it up in your interview, in your contract stuff. you bring it up. 25 to 30 bucks extra per patient is what the average is that they'll give you. So if this month you see 700 patients, that extra 200 patient would be a bonus money for you that you will definitely be able to make. So ask them to put that in that contract for you. If the physician is not offering you benefits, I talked about this also with how the pay are different if they offer you benefits versus not offer you benefits. You can negotiate and ask them to give you some money to help you with your insurance premium. Now, say you're gonna pay $1,000 a month for insurance. I don't know, I'm just making something up. You can kind of just ask them, like, per month, are you willing to give me half of it or even quarter of that amount to help towards my insurance premium, since you know you're not offering insurance and I really want to take the job, but this is actually a big deal for me. The next thing that you should really try to have in your contract is money for educational purposes. Now, we are in a field that we have to do our CEUs, we have to keep up with our licenses. There's a lot of fees for all of these things. A lot of physician will compensate you and give you educational credits to help you with like your licenses and anything that's educational that is going to be beneficial for them. You get all your certification, like myself, or my boss paid for my wound care certification. These certifications are very expensive, so a lot of them will definitely give you some money to help towards educational credit. Some of them, like I said, they won't bring up or mention anything about this, so you can bring this up when you guys are negotiating and talking about your contract. You definitely want to kind of bring that up and see if they're willing to give you, allocate any kind of money. In my case, there's no upfront money that was kind of allocated for me. However, anytime I have to pay for any type of certification, anything, I tell my boss and he literally writes me a check, hand it over, and says, here you go. I just show him proof that I paid for whatever I pay for that is educationally for me. Now let's also talk about how they're gonna pay you. Maybe I should have said this first, but some physicians want to pay you per patient and some wants to pay you salary. Now, I find that the physicians who don't have a lot of patients typically will want to pay you per patient. One patient is like $40 to $50 per patient, and this is nothing to do with the bonus. Bonus is separate. I'm talking about the physicians who don't want to give you a salary. Then you do want to also have a conversation with these physicians about the fact is, if they don't have the patient load or the patient population for you to see, don't get upset and get mad with me if I'm not hitting these numbers. And you do have some of them that definitely will get upset. Or you have the ones that say, well, I have an office, you can come to my office and work. You guys need to kind of iron that out so that you know. For me, my boss has his own office. I have patients in the nursing home and I also do wound care. I am never short of patients for me to see. In fact, I have too many patients. However, you do have some physicians who don't have that much patients in the nursing home setting and they hire you as their NP only for the nursing home setting. But then when you cannot meet the quota or the amount of patient you're supposed to be seeing, then they get upset and they're saying that you're not doing your job, but there's not the patient load for me to see. So you definitely want to have a conversation like that with them, or you guys work something out where they say, well, come to the office and work once a week or twice a week to kind of make up the fact that you're not seeing that many patients. Iron that out, because you don't want to get into a situation where they try to say, well, you're not seeing the amount of patient that you're supposed to be seeing, and then they review you and all kind of foolishness. Those are pretty much the major important things, in my opinion, that you really need to iron out, negotiate, and ask for when it comes on to your nurse practitioner contract. Alright guys, that is it. I hope you guys got some educational factor out of this and learned something. If you did, make sure you are subscribed to my channel and also click that notification bell so you are not missing out on any of my content. Thank you guys again so much for watching, and I'll catch you guys. Bye guys.